Good morning, good afternoon, good evening, whatever it is for you right now. Welcome to our Interprofessional.global global cafe entitled Playing Well with Others. We are very thrilled to have you here joining us. We are recording this meeting. My name is Maha Habre. I'm a clinical assistant professor of nursing at the Lebanese American University in Beirut and Byblos. I'm also a member of the Arab Network for Interprofessional Collaboration, which is a network that has been launched last year officially as a member network with Interprofessional.global. So today we are having a wonderful speaker among us. I'll introduce her in a minute. With us also here moderating or helping facilitate this session is Dr. Anthony Breitbach from representing Interprofessional.global. As I mentioned, we are recording the session, and soon after the end of the session, we will be posting the link or the recording on the website, so you can also access it thereafter. Just for housekeeping, in case you have any question, please raise your hand, use the raise hand function within Zoom, or you can type it on the chat box, and we will have time for discussion as well within this session. So introducing here with us today, Dr. Kelli Fox. She is Stony Brook Medicine's inaugural director of the Center of Interprofessional Innovation in Stony Brook University in New York. The center is charged with building a centralized interprofessional education and collaborative practice presence across health professions programs and fostering interprofessional education, research, and clinical practice. Prior to her appointment at Stony Brook, Kelli was an associate clinical professor and the director of practicum education, assistant director of the University of New England's Masters in Social Work program, and a longtime champion of IPE and IPCP. That's what I will be calling Interprofessional Education and Collaborative Practice. She was instrumental in integrating IPECP at the University of New England Social Work curriculum. She's also an active contributor to this university's Center to Advance Interprofessional Education and Practice, and served as a trainer, facilitator, mentor, researcher, and designer of IPCP learning. In May 2023, Kelli has completed her doctorate degree from Millersville University, and her research focused on the importance of supporting the uni-professional identity of social workers as preparation for their interprofessional team learning. So Kelli explains her rationale for the study, saying, as an IPE facilitator, I observe social work students struggle with finding their place and their voice among other healthcare students. The uni-professional pre-briefing offers these students an opportunity to anchor the unique skills and perspective the profession brings to interprofessional collaboration, and they begin to develop interprofessionalism. So Kelli's work in this arena is novel, and she has presented at local, national, and international conferences, and her research has been well received. Kelli is currently a member of an interprofessional team and an international team looking at positionality and the role of social work and hierarchical implications in interprofessional collaborative practice and learning. Along with her emerging role as a researcher, she is passionate for global health and wellness, and which led her to serve as a co-director and faculty facilitator for an interprofessional cross-cultural health immersion in Ghana, Africa. This program offers primary care health clinics in multiple communities in the Sekondi or Takoradi region, and this international health immersion provides faculty from UNE and Cape Coast University in Ghana, local practitioners and public health workers, and students from both universities opportunities to learn with, from, and about each other while providing valuable services to the local community members. It's a pleasure to have you with us here, Dr. Kelli Fox, and we're all ears for your presentation on playing well with others. The floor is yours.
I have to say that is about the most comprehensive introduction I think I have ever had. So thank you very much. I did not expect that to be completely read. So thank you so much. I appreciate that. Well, I'm delighted to be here with you, and I'm just, I'm really delighted to have people from all over the world joining us. So thank you for inviting me, and I really appreciate it. So as the, part of the introduction, this research came about as a result of being a faculty mentor to students in social work who were struggling with engaging in interprofessional collaborative learning at my previous university. And we sort of had informally developed some meetings with students to just sort of prepare them for what to expect. And out of that, I decided to really take a look at what do students need to be prepared to engage in interprofessional education, particularly for social work students. And this research, because it's in the U.S., there's a lot of parts of it that I'm sure are relative to the U.S. And I think sometimes in some ways to social care in other countries. So
That's wonderful. In fact, it's very valuable research. So go ahead.
thank you. So this is the landscape. When I really looked at why do social workers need to be on interprofessional teams in the first place? In the US, for the most part, social workers have to be master level trained in order to work in hospitals, primary care clinics, in mental health, and they have to be clinically trained. And so looking at where the demand for social workers was going, I found in the US labor statistics that between 2019 and 2029 that there was going to be at least a 14 to 70% growth in the need for social workers. And then post-pandemic, I think we can understand why social care and social work is so valuable to healthcare, because we know that a huge part of healthcare really has to do with the social determinants of health, how mental health and well-being affects and self-care affect people's physical health. I also looked at, the quintuple aim. Of course, the quintuple aim talks about the need for team-based care and why this is so important, and in terms of outcomes, patient satisfaction, provider satisfaction, the reducing of cost. And in recent years, the quintuple aim, or the fifth aim, has been added around the health equity and the access to care. So there's also a level of complexity to navigating multi-level systems of care. I'm not sure that this is just unique to the US. I assume that this is probably in other places as well. And so that, patients often have this fragmented level of care. And so really looking at how do we create teams that are more effective and more efficient and make care easier for people to navigate. And social work students and other health profession students have to be expected to be workforce ready. So they need to be able to jump out into the field and to be not just have the skills for their profession, but they need to be ready to work in a team environment. And so in terms of the response for healthcare programs across the US, and I believe probably in Canada, that the accrediting bodies for social welfare, for social work and healthcare programs have really made it clear that interprofessional collaboration and education and practice have to be part of the curriculum. And in 2016, the Council on Social Work Education, that is the accrediting body for all programs across the US in social work, they have to have interprofessional education as part of the curriculum. In 2022, they added interprofessional education and collaborative practice 5 times into 5 of the 9 standards of practice. So this is really important. And that's important for both faculty in social work as well as students to understand contextually. That is not just a nice thing or fun, but that is essential to their learning process. So the context for my original research was really looking at the academic institutions, IPE and IPCL culture. Having come from a university that was really had a very high level of IPE and interprofessional learning culture, this really made a lot of sense that students in healthcare and social work included really had to be a part of this and really had to learn how to play well with others. So when we had students who went to practice in these interprofessional immersion experiences, students would often find people would say really unkind things about the role of social work. Or they would simply say, why does social work have to be in a healthcare team? What do social workers have to do with this? And social work students would have a little bit of a thin skin and feel kind of offended and come back and say, I don't want to do this. To which I and a couple of my colleagues had learned to reply, if you want other students and faculty to know what you do, you have to step in and you have to tell them what you do and talk about your scope of practice. But clearly they didn't know how to do that, and they didn't know how to step up and use their voice. So we in our social work program adopted a uniprofessional meeting for students prior to the IPE learning. And as I said earlier, as a result of that, I really wanted to know, do uniprofessional meetings matter? What would it look like if it did matter? And how would we measure this kind of intervention in preparation for students' learning outcomes? So some of the challenges that are unique to social work students and to social workers in general on healthcare teams is that social work has a very unique theoretical underpinning, that while there are other professions that have similar focus, like occupational therapy, and some counseling and even psychology programs have a similar kind of theoretical underpinning. Social work has a really broad stroke of what it looks at in terms of people's well-being. We look at the biopsycho and spiritual aspects of someone's life to really look at the full being. So we're looking at environmental factors, we're looking at family factors, we're looking at cultural factors, we're looking at spiritual factors, community factors, access to care, those kinds of things. And these are pretty unique. This broad stroke is pretty unique to social work. And there's also the piece about advocacy, which is another piece of social work that is quite unique. So this often creates misunderstandings because most people that my students encounter, and sometimes I have encountered, is that there's really a misunderstanding of what the scope of practice is for master level social workers. And so my students and I have encountered things like a misunderstanding or some stereotyping or some bias and really hierarchical attitudes. So when we talk about positionality, when we look at social work, and they generally work with people who are really the most vulnerable populations. And when we think about positionality, that position of who they care for impacts how they're looked at on a team. And so a lot of students would encounter things like, well, social workers only do discharge planning, as if discharge planning is just only, as well as other things. And they don't understand that master level social workers, especially clinically trained ones, also are trained in mental health, they're trained in substance use disorder, and they're trained in developmental issues as well. So the other thing that became really clear is that social work students were not prepared to deal with conflict. They weren't prepared to deal with the power dynamics or how to manage those. So when I looked at the literature, I really wanted to find out, what was written about social work education and social work educators and students and interprofessional education. And what I found is that it's a fairly new addition to the IPE literature. And in some of the things I read, primarily is that social work was not included in many places where there were other health professions. So you might have a college of health professions that didn't include social work, but they included every other kind of profession. There are places where the School of Social Work is a sort of a separate college, and then there's a health profession. So there was not a lot of overlap, which led to some confusion about how to even include social work students and educators into the mix. There are also barriers to collaborative learning. I think this is true for a lot of students. You can't just throw students together and expect them to be able to play well together, or to know how to function in a team. So that becomes a barrier in and of itself. And then, the whole piece about, where do social workers fit on a team? And so the other piece I looked at, and discovered along the way is something called professional centrism, and the experience of hierarchy and power dynamics in the context of teams. And the work around professional centrism is very similar to the idea of ethnocentrism, which is that, people who are raised in a culture begin to believe that they are at the top of the heap, right? That what they think, what they believe, how they see people, how they treat, people, their assessments, that in a context of a profession, that profession begins to believe that they are superior to all others. And that's part of the outgrowth of siloed traditional education. And so, of course, when students come together and they all think that they are better than each other, it makes it really hard to talk about the overlaps and the complementarity of their work. And the other thing I looked at is what I looked at the literature for students prepared for interprofessional education. And I found very little literature that actually talked about specific ways to prepare students for IPE. And so some of the things I did read had to do with the faculty influence, how faculty influence those things, and really about how unprepared students were for conflict management. So here's some of the conclusions that came out of my research, and what some of the gaps were. I really saw that social workers were clearly, in all the literature I read, that they were integral to healthcare teams. That there was a perpetuation of hierarchy, not only in the professional world, but also in the academic world, and that was not only among students but also among faculty. Social work students are not prepared. That most of the research looked at the focus on the IPEC competencies and attitudes rather than actually how to prepare students to engage in interprofessional collaborative learning. And there was lack of research on how to prepare students to develop and address power dynamics. So out of that, I developed an intervention, a workshop called the Uniprofessional Pre-Briefing. And in this, I had thought about what I really like to do is I really want to contextualize IPE in the context of social work education. I want to help students look at the benefits, challenges, and the barriers in a realistic way. To increase social work's understanding of their role on a healthcare team, and on a student team. And to really improve students' ability, self-efficacy and their ability to feel confident in what they do and who they are and how they practice. So in the development of this intervention, and in terms of intervention research, you look at things from two ways. One is the problem, what is the problem and what is the solution you're creating? So my main theoretical framework for looking at the problem was professional centrism. Really that idea that, when students are raised in a silo, they don't see the value or as much value as other professions on the team. And so helping students also didn't understand their own value on an interprofessional team. Students come into the program often with very little understanding of how to work in a team, and they're really not prepared to deal with conflict management. And I think sometimes we have found that students that have come into social work often are a bit conflict avoidant, as I'm sure many of us are. So the solution was to create an intervention or a workshop that used relational cultural theory and relational learning theory. So I really wanted the intervention to be able to directly address things like professional centrism, looking at the history and the tradition of traditional roles in healthcare and the hierarchy that gets set up. And I wanted to provide some guiding principles for faculty to engage with students and create a psychologically safe space to talk about those kinds of things and encourage not only the anchoring of the professional identity, but the beginning of the development of an interprofessional identity. So the workshop has really student-centered activities. So I have activities in it that really promote student self-reflection, really looking at their own bias, how they see themselves, how they see other professions, what they know about other professions. Begin to help them, really encourage critical thinking skills and developing an awareness of the context in which they're working. Provide opportunities in the workshop for building authentic relationships with each other and with the faculty presenting, to engage students in a dialogue about issues of power, and to really demonstrate as a faculty member the role of interprofessional collaborative learning and practice, both through my words, my actions, and also talking about my experience as a clinical practitioner working with young children and families. So this is sort of the flow of the workshop. There's a basic welcome. I do an overview of what the context is. I introduce the learning objectives, ask students to introduce themselves and their experience. We do a brief icebreaker. I talk about the interprofessional education competencies, the US competencies, and the counsel and social work education competencies around interprofessional collaborative practice. We talk about the social work identity and their roles. I introduce them to the concept of professional centrism. I give them opportunities to really think about, what is the role of social work? What is your unique lens as a social worker? How do you bring that to the interprofessional team, and how do you use your voice? And I do that with students doing some paired activities to do some small group work. And then we do a wrap up and I ask them to complete an assessment. So my hypothesis was that, is that, the participation in a uniprofessional environment will really improve students' preparedness for participation in interprofessional learning. And that I really believe that the learning outcomes for students and the value would be enhanced if the workshop components and delivery were well designed and delivered by a faculty who really was able to model the value of interprofessional practice. So this is how I conceptualize the variables. So what you'll see is the variables here, these are the learning objectives. Increase confidence in students' ability to respond and not react to bias and stereotypes, to increase their confidence to respond to implicit and explicit hierarchy, to really increase their understanding and importance of and context of collaborative learning and practice in their social work curriculum, and really increase their understanding and ability to describe social work's role and their scope of practice on a team. And then these are sort of the effectiveness of delivery components. If you've, in many workshops that I've attended over the years and seminars, when we fill out the evaluation survey, these are some really standard things that are asked in those surveys. And I ran a training institute for 3 years. And so I became very familiar of the things to ask about, whether or not the workshop was delivered effectively and the components worked. So I developed an evaluation tool. I did not use a tool that was previously had psychometrics because I really couldn't find any. So I developed my own. And for the learning outcomes, I used a retrospective pre and post test survey using a Likert scale to really look at the students' learning objectives before, to think about their what they knew about the learning objectives before and after. The the effectiveness of delivery and the components piece was just a post-survey design. And then there were 3 qualitative questions to capture participants' experience in a narrative way. And they were very simple. You know, what went well, what could have gone better, and do you have anything else to ask? I did ask some demographic questions. The survey was completely anonymous, but I did ask a few demographic questions related to age and gender, just to see what my sample looked like in terms of the greater population of social work students in the US. So the participants were students who attended the Interprofessional pre-briefing from 2 different universities that I worked with. The participants were those who agreed to complete the survey. One university was a private university in Maine, the other was a public university in Pennsylvania in the US. And my final sample size was 15, and I had a total population of 26. And so 15 wasn't bad as far as I was concerned. It was a little more than half, so that worked. It also made it so that I could do parametric statistics, which I understand was really helpful. So when because I really wanted to look at the psychometrics of the scales that I was using, I used a Cronbach's alpha data analysis to look at, you know, the learning outcomes in the retrospective as well as the post test for the outcomes. And the Cronbach's alpha was pretty high, as you can see, which indicates that they were measuring the same, they were all measuring the same concepts. And then the overall effectiveness of delivery also had a fairly high Cronbach's alpha when I looked at those as a full scale of 6 items. So I'm going to stop and just take a breath. Does anybody have any questions or comments or anything that they want to ask before I move on? Okay.
And feel free to put questions into the chat if you'd like during the presentation also.
Yes, and you're free to raise your hand, and I'm fine with that as well. So when I looked at the results for the evaluation, what I found was that all of the paired sample t-tests for all of the learning objectives from pre to post test were significant at less than 0.003. And what I took for that was that students' preparedness and their confidence in their ability to be prepared for the interprofessional education and participate meaningfully increased for all students that participated in the survey. And that and the other thing I wanted to look at was if the learning outcomes had any correlation to the effectiveness of the way that the workshop was delivered and the components of the workshop. And so what I found in looking at that correlation was that that there was a positive correlation, so that the effectiveness of delivery scales, outcome, and the learning outcomes all did have that positive correlation. So students described that they had developed a sense of self-efficacy and confidence in their dual identity as a social work professional and an interprofessional team member. And that came out both in the quantitative results and in the qualitative responses. And the qualitative responses really did support the qualitative data analysis, the quantitative data analysis, which is what you want when you're triangulating that data. So some of the limitations of the presentation, I mean, of the research, is that obviously I had a very small sample. You know, this was not a good enough representative sample, but I think the results are pretty good despite that. The demographics, while there was a lot of it was close to the demographics for MSW students across the US. It didn't fully reflect that. So it reflected it in terms of the age of the students, but it didn't quite make the representation in terms of the gender for students in MSW programs across the US. The qualitative data, it was very small qualitative data, but it really probably could have benefited from having a second reviewer to look at those qualitative samples, but also probably to have an independent reviewer other than myself, because I knew what I was looking for. And I think, as any good researcher will tell you, if you're looking for something, it's probable that you'll find it. So it probably would have been helpful to have a secondary reviewer or an independent reviewer. And I think going forward, that is certainly something I would want to do. The population was limited to only 2 universities, and I was affiliated with both universities. One I worked for, and the other one I was a student in. And about 80% of the students from the university, the private university where I was teaching, knew me as a faculty member. So I don't think that because it was anonymous, it could have influenced how students responded, but more so, it probably had to do with why students responded to the survey when they may not have if they didn't know who I was.
There's a question in the chat box regarding the level or the year of the Masters in Social Work program. What year were they in, the participants?
So I had let's see, out of 15, I think I had 9 students who were second year MSW students, and I had 6 who were first year MSW students. So yeah, so that's how that broke out.
And the pre-briefing intervention was done for all at the same time?
No, actually, it was held 3 times. So I did 1 session online for the private university, the public university students, only because of proximity. And I think I had 9 students in that cohort. And then I offered it 3 times at the public university. I mean, at the private university. And so I had a little bit more, and those were in person, they weren't online. So, and the research was done in the fall of 2022, and my results and my dissertation was presented in the spring of 2023. So my conclusions from that is that I think that the uniprofessional meeting or a uniprofessional meeting prior to students' engagement in interprofessional collaborative practice does a number of things. I think it helps to contextualize IPE in terms of students' curriculum. And I think this is true whether we're talking about social work students or we're talking about students from other professions. I think nursing students, particularly undergraduate nursing students, sometimes experience the same kind of misunderstandings when they engage in interprofessional education with other students as well. So I think being able to contextualize that, I had an opportunity yesterday to work with some folks from our Masters in Public Health program, and interprofessional education clearly shows up in their standards in a very clear and direct way. And when I was talking to the faculty about it, they only kind of knew what that meant, and what that looked like and what the requirement of that was. And I'm also finding that even if faculty across other health professions do know that they have interprofessional collaborative practice or education in their standards, they don't often know about the other US IPEC competencies and how that fits with the standards that they're supposed to meet for their students. So the meetings seem to enhance students' confidence and their preparedness to engage in interprofessional collaborative practice. It supported students' professional and interprofessional identity, I think, because students talked about that ability to be ready to practice as part of a team, to be willing to listen to other students' input and other practitioners' input, and to really step in to be part of that process. So my research also showed that when it's delivered well, that student learning outcomes are improved. I suppose that that I really also believe that going forward, that could be defined a little bit better about what that means to be well delivered. And if students feel confident in their ability to fully engage in interprofessional collaborative learning, it's expected that this will increase their self-efficacy, their confidence, and their development of identity as both a social worker and an interprofessional professional. I've been talking with folks about this idea that, we want students to be ready professionally when they step out into the field. And we spend a lot of time talking about their profession and about their ability to learn those skills in their profession, which absolutely we want them to know. But if they're also not ready for this other skill when they go out into the field, they could be playing catch up. So that this skill becomes just as essential a part of their education as everything else that they do. So some of the implications for further research is that I would hope that other programs might adopt and implement some type of intervention that involves uniprofessional uniprofessional preparation of students. That I really believe that this type of uniprofessional training could help train faculty who are new to IPE or be included in that. I think it can be adapted for use with students from other healthcare disciplines. I also think that what would also be really helpful in doing this presentation or delivering the workshop would be to have at least one other faculty from another profession working together to do this. I did not have that when I did this, but I think that is something I definitely would want to do at another point. I think that it would be really great to do some research post post the student's experience of an immersion to really explore if it had any impact. And I also have become really interested in looking at this idea of interprofessional identity development and how do faculty influence that idea? Looking at, I know a lot of the research that's been done really looks at, putting students into teams in a longitudinal way and having them work together, really having that opportunity for frequent socialization and frequent contact, having more and more complex tasks to accomplish. But what I'm also I'm really interested in, because I think this is might also be really helpful to programs who are sort of struggling in how to include IPE in their programs, at least as a start, is that I think professionally, faculty could begin that process by modeling interprofessional collaborative practice, really talk about how that works in their own practice settings, what their experience has been, and really talking about that idea of professional centrism and how we develop that context through faculty modeling. We all know that when we model our profession well in the classroom, that our students pick up on that. It's a parallel process. So it's not always what we teach, it's how we teach it, that we're also conveying information. So I think this is also, also true. So that's what that's what I'd really like to do going forward. So that's it.
Wonderful.
Great.
Wonderful. Thank you. Thank you
Sorry,
so
Maha.
much. Go ahead, Anthony. We have a question from Anthony and then some questions and discussion in the chat box. Go ahead.
Yeah, I just was bringing to attention that Jan Jaap Reinders would like to ask a question on camera instead of trying to answer it out of the chat. That's all.
Okay.
Nice job, Kelly.
Thanks.
Wonderful. Thank you, Kelly. Go ahead, Yanya.
Hi,
Good
Anya.
to
Nice
have
to
you with
see
us.
you.
Hello, nice to see you. Thank you very much for your interesting presentation. And yeah, you with your approach, you also introduce anticipatory socialization
Yes.
as a new bridge and a new approach in IPE. I think that's very exciting. I was wondering, because there are, of course, there's still many questions as you point out. I was wondering what your ideas are, because you're seeing a connection between first of all professional identity formation, and this professional identity formation really strengthens the position of the students as team players. I can also imagine that that you can have other results for their focus, their perceptions related to interprofessional collaboration as part of this professional identity formation in their own, their own professional single profession circle, the social circle. I can also imagine that we still have to learn a lot about any kind of social identification, that identification itself might be different with regard to efficiency and effectiveness. And I would just like to ask you to share some ideas. Maybe it's a kind of a complex question because it is quite complex, the identification process. But what are your ideas on how this professional identity formation might, in what way, influence interprofessional identity formation? Is it clear what I mean?
I think so.
Yes.
I don't know that I have a full enough answer to provide for you, Yanya, but I think that one of the things I'm really interested in is, and maybe this is part of that research that you have done also about, we know that as professionals and as educators, we influence how students experience themselves as professionals and how they come out. And so in that same kind of way, I really do think that we have a role and a responsibility as educators to also transmit or transfer or model that interprofessional collaboration and that value of interprofessionalism. And one of the things that I'm hoping to really work on is conceptualizing what that means as an educator. What does it mean to put forth IP as a value? What does it mean to put forth interprofessionalism as an important part of our professional self and identity? So I don't have a clear answer about that, but I do think that there's something in there that I think can be conceptualized. Some of the ideas I have is, do as a professional, do I know what other professions do, and can I convey that to students? Do I have an experience of what that looks like, that I can talk about, from my own practice experience, from being an educator? Do I know the overlaps? Do I know the complementarity? Do I understand professional centrism and how that works? And can I help students to think about that and how to step forward despite that in a professional manner, just like we want students to be able to engage in those kinds of conversations. Does that make sense? Did I answer that for you?
Yeah, I absolutely, and I think it's also very exciting because what you're also telling is of course there are some new interesting question marks, but they provide direction for future research and development and understanding on how this role modeling influences these perceptions from a single profession point of view. If I paraphrase you clearly.
Yes, yes.
Yes, thank you.
I know that there's some work that's done in social work by a professional who's been around for a really long time, where he talks about this idea of parallel process, and that what we teach in the classroom and the way we teach in the classroom, the way we practice as a clinical supervisor or as a supervisor, that how we do that, how we model that is as important as what we teach. And I think there's some other examples of that in the literature around educators. So I see Shelley has her hand up.
Absolutely, yes. Go ahead,
Thank
Kelli.
you.
And then we have some questions on the chat box as well.
Okay, I'll be quick. One is a comment that Chris Hall wanted to convey to you, but she had to go do something else, which is we've been running an interprofessional team immersion for, I think it's 14 years now. And we really notice a difference between the students who have had uniprofessional engagement prior to the team immersion and those who have not. And those who have seem to have more confidence, be able to address some of the power dynamics that are going on, and are able to step back when they feel criticism and kind of catch their breath and move forward and say, well, maybe you don't know what social workers do. Or maybe, it's interesting, maybe I can help you clarify what an OT's role is, and as opposed to those who don't, who get really angry and defeated and often need to time themselves out. So Chris wanted me to convey that to you, but I was wondering if, you talked earlier about the power dynamic and the hierarchies within health education and how the uniprofessional opportunity really helps with that.
Well, I think, from the perspective of relational learning and relational cultural theory that says, and feminist work, which is, a backdrop and foundation for my research, is that, when we can make things talkable, when we can make something real and we can address it directly, that we then have an opportunity to move past it, or to at least find a voice to move forward. And as you said, students won't back down as easily, and they're more likely to be able to step in and understand what's happening, as opposed to, oh my gosh, what is this? And, they don't like me, they don't care, they don't understand me. So I think there's something about really being clear that that is real, that this is not anybody's imagination, that it's real, and we can talk about it, and we can move through it, and there is a way to address it in a professional way. And as you described, Shelley, I think that's a perfect way in which students have an opportunity to really talk through that, as opposed to running away from it and feeling wounded.
Thank you, Shelley. So we have a comment from Zoe on the chat box saying that she definitely agrees that role modeling is very important. She teaches in an allied health professionals post-registration. And we also have a question from Dr. Nasser Sharif saying, while we may work on the professional identity of our students and instill the confidence needed to address their unique contribution to patient care, they still have to deal with the hierarchy in healthcare, which varies from one country to another, from one institution to another. So what is needed from that perspective, handling the hierarchy, basically?
Carefully. I think it has to be, I think it has to be addressed carefully and with professionalism. And, I think, I know that saying those words out loud here, in my context, I've had to say it very carefully, but also to say it in a way that lets people know that this is not unique to Stony Brook. This is not unique to one healthcare setting, that this is this is tradition, this is history. And I think part of, you know, understanding why it happens, I think is also important. So not that you give into it, but that in spite of it, that you are able to still step forward with respect. But it is, you know, I think if we just acquiesce, nothing will change. You know, my secret hope is that we're training a whole new generation of healthcare professionals who can change the dynamics in healthcare. I know that you know, when I was in my previous role at UNE, watching medical students embrace the other students and step back respectfully to let other students step in, and then to watch students work collaboratively and share power. It was just an amazing and beautiful thing. And I think that finding ways to continue to support that when those young professionals go out into the field is really an important part of what we also need to be teaching preceptors and, you know, people who teach fellows and those kinds of things. So that's I think that's the way that I think it needs to happen. But you know, that's just one girl's opinion.
Well, it is based on your research work, and I do support your opinion, to be honest. We have a question from Dr. Bahia Abdullah saying, thank you for an interesting and comprehensive presentation. What would you recommend? What are your recommendations for curriculum integration of IPE based on your findings, particularly for the medical school curriculum, which is considered like as the most prestigious profession? At least I'm talking in our country. I'm sure others can relate. What would be your recommendation for that?
I think finding IPE champions or interprofessional champions within the faculty or within a university healthcare system or in a healthcare system who can come in and model that for students, who can really talk about, I have suggested to faculty in our medical school to, you know, bring in faculty and practitioners from our cancer center, for example, because our cancer center folks work together really tightly as a team, and they work interprofessionally. In our obstetrics and gynecological services here, they work really closely as a team, both in care as well as in research. So I think one of the ways to do that is to bring in practitioners and faculty from that profession that can talk eloquently about the importance of interprofessional collaborative practice, why it's important, how it works. Get patients to come in and talk about how that works and that experience. I think that's a way that you can do that uniprofessionally, and also having faculty who can model, that, nurses matter. We can't function without the nurses in our midst. We can't function without what the social worker does in healthcare. I think that that's really the way to bring that about, is that it really is about an attitude change about how we model that and how we talk about that as professionals. Believe it or not, as a social worker, I also can be very biased about what social workers do and how we're trained compared to other mental health and substance use disorder professionals. So it's not unique just to medical school.
True. So just based on the research you've conducted at those two universities, are social work students involved in IPE at the undergraduate level, or is it just in the master's program? Because your sample was master's students.
Yeah, I know at UNE there it's both. We introduced it into the curriculum there and made it mandatory for students in social work in the master's program and in the bachelor's program. Here in this university, the social welfare program is trying to figure all of that out still. And that's part of my role here. And right now it's primarily with the master's program, but I think because of the accreditation standards, it has to be placed in the undergraduate program as well. Other questions, comments, thoughts?
I'm sorry. Okay, we have Alison with a question, and we have another question on the chat box. Go ahead, Alison.
Thanks, Kelly. Of course, it started raining again now. I can't believe it. Kelly, this is genius. It's absolute genius. I wanted to say it's so simple, but I thought, oh my God, how many years you've been doing this? It isn't simple, but it's absolute genius, because I think a lot of us think the first thing is we must get our students to engage with IPE. But you're absolutely right. If they're not adequately prepared for that experience, they're not going to get the best out of that experience, are they? So you've really made me think about when the first introduction to IPECP is positioned within a program, particularly for undergrad students who have no experience at all. So yeah, absolute genius. Thank you so much. It's been a brilliant presentation. Thank you.
Thank you, Alison.
Thank you, Alison. We have a question from Omar on the chat box, and he says he's wondering why would students choose to enroll in a social work program. Basically, he's sharing his experience. He's from Oman, and he says in the Arab world, most of the time, the major is chosen by the grade and not by the student him or herself. Any comment to that?
Well, I think most students who come into social work have an idea that they really want to help people. Sometimes they come in with having had experience with social workers in their life. I think sometimes social work finds students who or people who already have a view of the world that fits for them. Social work does have a really unique lens in terms of looking at that wide picture. I know for myself, I can tell you that I thought for a long time that I wanted to be a psychologist, and when I found social work, it fits so well with really how I saw the world in terms of how all of these components fit together to create where someone is in their life. It became this sort of interwoven part of who I was. I also came from working with social workers who had a perspective that I absolutely understood when I was working with families where there was a young person with substance use disorder. So, and I also can tell you for myself, I also thought about going to medical school, but I realized that I don't like blood. I don't want to work on cadavers. And I'm a little bit squeamish about those kinds of things. So.
Thank you. Anthony's hand is up, and Omar as well. Omar has asked a question on the chat box. So maybe you want to add something, Omar, to this conversation. Go ahead.
Hi, how are you? I just want to add to what Kelly was talking about, the social worker. I'm a physician, and I think my experience in the Arab world is that we have the ego of the medical doctor, and that's a major problem. So that's why I'm linking my question to that. Is that unfortunately even the social workers. Just to let you know that my father is a psychiatrist, so also, I live that environment, and unfortunately, people still undermine the importance of the social workers, of the nurses, and the psychologists, and people still they don't know what's the difference between a psychologist and a psychiatrist, for example. So the awareness is very important for everyone. The society, the institutes, the people themselves, and everything like that. So that's why I'm really, I mean, when I met many of you in Qatar last year, interprofessional education, we do it, or we've done it, but without let's say, the jargon, okay? And we do that in different places. So I just want to share this, and I really appreciate the work and everything like that, and I hope that we can do a lot in all the health profession, and I think public health in general need to be looked at and with all its dimensions. Thank you.
Thank you, Omar.
Thank you, Anthony. Go ahead.
I just have one comment about that. I teach introductory interprofessional education, and the students who aren't comfortable with their own identity as a health professional within their profession, they seem to struggle a little bit more with that imposter syndrome, where they once they start interacting interprofessionally, they really feel like there's something missing there. So this is great. This is great stuff. Thank you so much, Kelli. Thank you so much, Maha. You've done a fantastic job. I'll turn it back over to you.
Thank you so much, Anthony. So if you have any further questions, now is the time. Last question. And if not, we are very grateful for your valuable sharing of this research, Kelli. It's really insightful, and we look forward to thinking together how we can add more uni-professional preparation to prepare better interprofessional collaborators. This is indeed valuable. Thank you so much, and thank you all for joining us.
Thank you
Good
so
afternoon,
much.
good evening, good day.
Thank you so much for having me.
thank
This
you.
was a great opportunity. Thank you so much.
Thank you.
And please attend future global cafes, and the recording of this one will be posted
On the website.
Yep.
Yes. Thank
Thank
you.
you, everyone. Yep.
Thank you, Maha. Thank you, Anthony.
You can also follow IP.G activities on LinkedIn and on the website and Instagram.